It's a very difficult topic to talk about. Why haven't we cured MS? Because the C word is really a word we shouldn't be using anymore, because if you work in the field of cancer, the cancer doctors stopped using this word about a decade ago, because even if you got to a certain point after being treated for your cancer, they could never be 100% sure you were cured. So they use the word called NED, N-E-D-D, and it stands for no evident detectable disease, rather than talking about cure. So I'll go through it, but the cure word is a difficult one to talk about. So to cure MS, do we need to know the cause of the disease? And although we don't know exactly what causes MS, we do have quite a lot of ideas about the factors that are involved in susceptibility. We have genetic factors, genes, and they interact with environmental factors. The virus, Epstein-Barr virus, it causes glandular fever, vitamin D and sunshine, and smoking all come together, and these work in some way to trigger the disease. Now, clearly, if we could target these, we may be able to prevent the disease, and that's not a cure. Prevention is a very different thing to a cure. Okay, so we're talking about people who've already got MS rather than people who don't have MS. So I'm not sure this is applicable to the C word. What we do know is that we have a working hypothesis, and a hypothesis is a term we use to explain a theory, and we can test an hypothesis by doing experiments. And our current hypothesis is that MS is an autoimmune disease. And you all know what an autoimmune disease is? So an autoimmune disease is where our immune systems that really have been designed to fight infections and possibly cancers go awry, and they attack our own bodies. So in MS, it attacks what we think is the myelin sheath, the insulation around nerves. That's the current thinking. So it is an autoimmune disease. So the hypothesis then is if we switch off the immune system, and I put a reboot button here, so if we deplete the immune system or deplete the immune system, allow it to come back, will we stop MS? So that's the hypothesis. And that's basically what most of our therapies are based on, is targeting the autoimmune, the inflammatory reaction, and what will happen. So what does a cure mean? So when the original therapies came out, you can see this is a natural history of the disease. So the majority of people who have MS, given sufficient time, will develop disability. Okay, and you can see there's attacks. And when you give them these treatments, we knew they weren't curing the disease in the sense that they would just reduce the number and severity of attacks, but people would still progress with the illness. Okay? This particular line here is what we're trying to achieve in terms of cure. Can we actually flatline people and stop them having any MS activity and prevent them from becoming disabled? Now that's where the problem lies, because a lot of people think that if we cure MS, people are going to get back their function. So when you have inflammation that's coming, and you can see on this slide it's somebody who's not disabled at all, got no disabilities. If we stop the disease, that they will be completely normal, theoretically. When somebody's already acquired some damage as a result of the MS, okay, will they get back to baseline? And the answer was probably not. If we had a cure for MS and get rid of MS, the damage that's been left behind is still there. So people shouldn't really expect to see this, although we do see some recovery. So some people who go on to the more effective therapies and the disease gets suppressed, we do see some spontaneous recovery. That doesn't mean to say that drugs are doing that, medication. It's that the spontaneous recovery that's occurring in the nervous system. And then some people, even if we stop the disease, they may still get worse, but not very quickly, not as quick as they didn't have the treatment. And we think the reason for that is that if you damage the nervous system, it doesn't just degenerate over the next few weeks. It may take many, many months or years to recur. And that's what happens in some of the more effective therapies when they've been tried later on in the disease. Although they stop the inflammatory component, the relapses, and they switch off all those MRI activity, people still continue to get worse. Okay, and that's because of the damage plays itself out over the next few years. And the other option is, which I think is hopefully the realistic option, is we can stop people getting worse, and this is the real aim. So this particular observation of continuing to get worse, stabilizing or improving, depends on when the disease is treated. And we call this the window of opportunity. And we've got a publication, a paper that's coming up, looking at a drug called Tysabri, natalizumab. And what we noticed is that when the people were treated very early, okay, they were more likely to improve than when they were treated late. So this ability to recover from previous damage is a time factor. It's got to do with how much damage has already occurred. And there's also an age factor. So the older you are, that's just a fact of life, unfortunately. Your repair mechanisms are not as good when you're older compared to when you were young. So the natalizumab data suggests that the earlier the drug is used and the sooner it's used, the much more likelihood of you improving. Now, does this cure people from MS? And that question cannot be answered. And to explain to you what a cure means, you have to understand this curve, which is called the survival analysis. So survival analysis means is how many people don't progress with the illness. So it actually comes from the cancer field. We talk about how many people die from a particular cancer. And if you give enough time, most people die. And it's true, you all die. Life's a terminal illness, okay? And the way we use it is in MS, we say, instead of talking about death, we talk about time to a certain point, and let's say secondary progressive disease, which is an important outcome. All right? So how many people take to get to become secondary progressive? When we look at the survival curve of secondary progressive disease, looking at the natural history of this disease without any treatment, it's about 15 years. There is variability. Some studies have suggested as early as 10 years. Some have gone up to about 20 years. But on average, about 50% of people with MS, with no treatment, will become secondary progressive at about 15 years. Okay? And you see over here, not everybody becomes secondary progressive. And the reason for that is there's a small group of people that have benign MS and never get secondary progressive disease. I'll put that at 15%. That definition varies depending on which studies you look at. And actually, it's probably less than 15% in natural history studies. When you go up to 50 years of follow-up, that's probably about 2.5% of people, based on the Gothenburg data series. So it's quite a small number of people who develop disability. Now, obviously, we would like everybody to do this. Nobody gets second progressive disease, and I think that's an unrealistic expectation because often we don't get in early enough with our treatments. This is what happens with some of our treatments. Some of our treatments obviously delay the onset. So instead of 50% developing secondary progressive disease at 15 years, it switches to 25. And we're not sure of this question yet, but maybe everybody ends up anyway in the same proportion. So some people will say, well, that's not good enough. But I can tell you, if we delayed the onset of secondary progressive disease by 10 years, we'd make an enormous difference to people's lives. Simply because we know that linked to secondary progressive disease is disability, and disability is the primary driver of all the factors we've been discussing at this meeting. Unemployment, bladder, bowel, they're all linked to disability. So if we can do this, okay, and I actually think we are doing this with our therapies, definitely. Okay? But this is what we really want to do. Not only do we want to delay the secondary progressive disease, we want to make sure that nobody ever ends up with the disease. Okay, so this particular gap is what I would call the C word, the cure word. If we can get people never to become secondary progressive disease and to flatline, in other words, and then become disabled, and we can go for 50 years, we've cured the disease. But can we wait 50 years to answer this question? That's the thing. So defining a curve, and this is what I would call a working definition, is we have to actually take people out many, many years after a treatment to see if we've changed the natural history of the illness. So, does this work? And I'd like to say it does work. Is David Baker, my colleague here, Professor David Baker, you heard him talk this morning. So he's developed a very important animal model of MS. And he takes a mouse and he inoculates it with spinal cord, the myelin proteins, on day 0 and day 7, and this little animal gets an attack, and then it gets relapses and remissions, and over time it develops secondary progressive disease. Okay? And he's developed a cure for this animal, in that if you take two groups of animals and you let them run their course, most of them become secondary progressive. But if he treats them with a particular therapy after their first attack, and this treatment basically is to deplete the immune system and then to re-educate it, he stops the disease and he cures them of the illness. Notice not everybody's cured. One single animal got a relapse later on, so it's not 100%. And notice they don't come back to baseline. Their score stays at 0.5, which means, although they're cured of the inflammation, they're left with a little bit of disability. Okay, and that disability was from their first attack. And that's why I'm trying to say to people that even if we cure MS, it doesn't mean to say your disabilities will completely go away. They may improve, but that's left over from the previous attack. And to get rid of that, we would have to have restorative therapies, which is a completely different issue to curing the disease. So can we repeat the animal experiment in MS? And I say yes, we potentially can. I say potentially because I don't know. And this experiment is running right now. Okay. So there are a few therapies that reboot the immune system. The most potent one is a thing called bone marrow transplant. Have you all heard about bone marrow transplantation? And there are quite a few cohorts of people who've had bone marrow transplantation all over the world, and they're now in a common register, and they've been followed up long term. And the bone marrow transplant follow-ups are, in the proper studies now, haven't got to 10 years yet. They've had a 5-year follow-up, and I think they're around about 7 years, and it's looking very, very promising at 7 years. Extremely promising. Another drug that reboots the immune system is a drug called cladribine. We did trials with tablets, and unfortunately the drug never got licensed and the company stopped the follow-up. So we have no idea what happens to those people who had the drug. But those ones who did get the drug very early have done very well so far, but we won't get any answers from cladribine. The other drug that does this is a drug called alemtuzumab. Have you heard about a drug called Lemtrada, alemtuzumab? It used to be called Campath. Well, that drug is now being tested in MS, and it's been licensed in the UK. It was originally tried in Cambridge, and the Cambridge cohort, the group of people that got it, have got to just under 12 years now, and a publication came out about 2 weeks ago looking at the 12-year follow-up. And at 12 years, it looks very good. Okay, 50% of people only needed 2 courses of the therapy and their disease is stable. Only of the 87 patients, I think only 2 or 3 people have progressed. Okay, only 2 or 3 people have progressed. So overall, it's looking very promising for the open label. In the trials, we've only got to 5 years, and it's looking very good at 5 years. The majority of people are doing that. But we can't answer the question, I don't think, until we followed people up for much longer than that, because as I said to you, those people may come back later on. They may come back over here with progressive disease. So it really is a 15 to 20 or 25-year experiment. And I don't think we can make any call on this until the cohort of alemtuzumab patients gets to 15 years. That's the kind of working definition we put forward, 5 years. Okay, 5 years. And that's going to happen in about 10 years' time. So now the question is, how do we define the disease activity being suppressed? So those of you who've got relapsing disease will know that you have relapses. Some people don't report all their relapses, unreported relapses, and worsening. And that's what we can see clinically in our clinics, and you can experience. We do know that some people have attacks that occurred, don't cause symptoms, and we pick that up on MRI. And some of you may have MRIs done regularly to monitor this process. And this is the stuff we can see. And we know now under the microscope that in a large number of people, some of the activity cannot be picked up on the current MRI scans we do. Okay, these are lesions that are occurring on the surface of the brain, and some of these lesions cause the brain to shrink. You may be aware that the brains of people, they may shrink a bit quicker than normal. Okay? And also, when you damage the nerves, that releases proteins into the spinal fluid, which we can measure. And all these things at the bottom now are not currently being measured as part of our routine care. And I personally believe if we really want to define getting rid of this activity, we have to measure the whole pyramid, not just the surface of the pyramid. Okay, we have to measure not the surface of the iceberg, but the whole amount. And that's to prevent this from happening. So we instead of calling it NED, we call it no evident disease activity. We currently define it as a person who's had a treatment, who's got no relapses, no worsening, and the MRI shows no new lesions. But I actually think we need to incorporate into that also the brain shrinkage part of the equation to really measure the whole process. And I think this is a technological issue. Professor Miller's, is he still here, Professor Miller? He's got the challenge of sorting this out from it, because at the moment it's difficult to apply this to individual people with the disease. It's easy to apply it on average in groups. But I think the next phase will be looking at that clinically. Okay? So the definition of a cure then would be NEDA after a treatment, probably at 15 or maybe 20 years. It's a debate we'll have in the field. And if we can get people to 15 years or 20 years with none of this, there's a good chance we've cured them of their MS. We've got rid of the autoimmunity. Okay? So I don't know if we can cure MS. All I'm saying is it's an hypothesis that we can, and the experiment is currently ongoing. I put this up here because this is a Black Swan, and some of you may have read the book, The Black Swan. Well, the Black Swan phenomenon is an economic argument that sometimes very rare events occur much more commonly than we realize. And MS may have a Black Swan coming in that we may have it wrong. Okay? MS may not be an autoimmune disease. And the reason why I say that is it doesn't explain everything about the illness. There's lots of observations we see about the disease. The incidence is going up. It's more common in females, the migration pattern. There's lots of things that we can't simply explain away by it being an autoimmune disease. So we may have it wrong. The MS may be due to an infection, maybe due to a virus. And this is why we're involved in the Sharko project testing this hypothesis. Okay, and that's why we've been running a clinical trial that will hopefully finish recruiting in the next few weeks to test antiviral drugs in MS. So why haven't we cured MS yet? Well, we may have. Okay, we need time to tell. Alternatively, a Black Swan may fly in to change the timeline. Thank you very much.